Understanding adrenal diseases, Addison's and Cushing's. Addison's disease and Cushing's syndrome are two serious medical conditions that affect the adrenal glands. These small glands sit atop your kidneys and play a crucial role in your overall health. They produce hormones that regulate essential bodily functions. When the adrenal glands don't function correctly, it can lead to a range of debilitating symptoms. Addison's disease occurs when the adrenal glands do not produce enough cortisol and aldosterone. Cortisol helps your body respond to stress and regulates metabolism. Aldosterone controls blood pressure and salt balance. Cushing's syndrome, on the other hand, develops when there's an excess of cortisol in the body, often due to prolonged steroid use or a tumor. Both Addison's disease and Cushing's syndrome can have a significant impact on your health and quality of life. Understanding the causes, symptoms, and treatment options for these conditions is crucial for early detection and effective management. Addison's disease, a deficiency of vital hormones. Addison's disease, also known as primary adrenal insufficiency, is a rare disorder that affects the adrenal glands. This condition arises when the adrenal glands fail to produce sufficient amounts of cortisol and aldosterone. Cortisol, often called the stress hormone, plays a vital role in managing stress, regulating metabolism, and controlling blood sugar levels. Aldosterone, on the other hand, is essential for maintaining the balance of salt and water in the body, directly impacting blood pressure. The symptoms of Addison's disease can be subtle at first, often mimicking those of other common conditions, making diagnosis challenging. Common symptoms include fatigue, muscle weakness, loss of appetite, and weight loss. As the condition progresses, individuals may experience nausea, vomiting, diarrhea, low blood pressure, and darkening of the skin. In severe cases, an adrenal crisis can occur, characterized by dangerously low blood pressure, dehydration, and loss of consciousness, requiring immediate medical attention. The most common cause of Addison's disease is an autoimmune disorder where the body's immune system mistakenly attacks the adrenal glands. Other causes include infections, tumors, and certain medications. Treatment for Addison's disease involves lifelong hormone replacement therapy to compensate for the deficiency of cortisol and aldosterone. Cushing's syndrome, an excess of cortisol. Cushing's syndrome, in contrast to Addison's disease, results from prolonged exposure to high levels of cortisol in the body. This hormonal imbalance can stem from various factors, with the most common being the long-term use of corticosteroid medications, such as prednisone, often prescribed for inflammatory conditions like asthma and rheumatoid arthritis. In other cases, a tumor in the pituitary gland or adrenal glands can lead to an overproduction of cortisol. The symptoms of Cushing's syndrome typically develop gradually and can vary depending on the severity of the condition. A hallmark sign is weight gain, particularly around the abdomen, face, leading to a characteristic moon face, and upper back. Other common symptoms include thinning skin, easy bruising, muscle weakness, high blood pressure, high blood sugar, and increased thirst and urination. Diagnosing Cushing's syndrome involves a combination of physical examination, blood and urine tests to measure cortisol levels, and imaging scans to detect any tumors. Treatment for Cushing's syndrome focuses on lowering the levels of cortisol in the body. This may involve reducing the dosage of corticosteroid medications, surgery to remove tumors, or medications that block the production or action of cortisol. Raising awareness and seeking help. Addison's disease and Cushing's syndrome are complex endocrine disorders that require specialized medical care. While they present distinct challenges, early diagnosis and appropriate management are crucial for improving quality of life for individuals living with these conditions. Raising awareness about these diseases is paramount, not only within the medical community, but also among the general public. Recognizing the subtle early symptoms can lead to faster diagnoses, preventing potentially life-threatening complications. If you or someone you know experiences any of the symptoms mentioned, it is essential to consult a healthcare professional promptly. Early detection and treatment are vital for managing these conditions effectively and improving long-term health outcomes.